Hi everyone, I have here with me my friend Carolina Solis. She's a board certified surgeon in the area of Washington DC. She practiced for the last couple of years, and we're going to talk today about a topic that's very important, and that is access to medical health, medical care. And I wanted to just start with a couple of questions, Carolina. What are the barriers that our community face in getting medical treatment?
So as a physician and as a surgeon, I deal with a lot with inpatients and people coming into clinic. And one of the biggest barriers that we see in the Latino community is that sometimes people are concerned in seeking care because they don't have insurance, or they're concerned about not being able to pay for it. And the other major concern that people have is their legal status. Oftentimes people are undocumented and they're afraid to seek out medical care because they fear potential repercussions.
Yeah. What do doctors do when they find out that somebody is undocumented? What is their duty and what do they do?
Honestly, as a physician, it's our duty to take care of patients regardless of their legal status. So it's not something that we really pay attention to. Sometimes it comes out, the patient may tell us when they come to the hospital, but it's not something that we go looking for or asking. So, regardless of your legal status, I would never discourage anyone from seeking medical care,
Yeah, so you have the right to care regardless of your immigration status. And I wanted to ask you a little bit about what would you recommend that people get insurance? A lot of times I hear in my practice that people don't want to spend that extra amount of money, but what are the benefits of having some sort of insurance?
I think that's an excellent question. So especially for young people, or if you don't have any medical issues, like why get health insurance? It can be expensive, it's an extra expense that you have to worry about, and especially if things are tight. But I would say one of the biggest reasons to get health insurance is you never know when you're going to have an accident. You never know if you're going to need an emergency hospitalization or if you're going to need emergency surgery. And in those cases, if you don't have health insurance, it can be very, very expensive, to pay for all the medical costs. So it's something that I would definitely recommend.
Yeah. I wanted to also ask you this question because a lot of times what I hear in my practice, and you would know better as a doctor how to go about this, I hear that people don't go to the doctor because, well, they can take medication that we may bring from our countries, that we can bring, or that they take the medicine that someone else has been prescribed because they're feeling the same symptom. What would you say about that practice that we tend to have?
Obviously, there are barriers to seeking medical care, as we mentioned, and so it can be daunting and intimidating to go see the doctor. So people oftentimes self-medicate.
Exactly. Yeah.
But what I would say, it's important to have a professional evaluation so that we know what we're treating. Because oftentimes, people say, okay, you had that cough, the same cough that I had, take this. But in reality, it may be something else.
Exactly. Yeah. So although it could be the same symptom, it could be something completely different. And so thank you so much for that insight. And look forward to having you here again.
Yeah.
Okay. Bye everyone, and stay tuned for more. Subscribe if you want to stay in touch.